back to Urban Health and Fitness. As part of our Strength Month, we are taking all elements about improving your overall strength. Today, I'm pleased to announce I'm here with Rosie, one of our chartered physios, and we're again talking about a bit of a physio and rehab focus. And in today's discussion, we're going to be talking about improving the strength around your hips and pelvis and why it's important. So welcome, Rosie.
Thank you.
So again, why is it important really to maintain the strength around your hips and pelvis?
So your hip joints are the fulcrum to your whole body. No movement can happen without the stabilising joint that the pelvis controls. So having a good, stable, strong pelvis is so important for everyday function and including other hobbies that you enjoy doing. The pelvis is made up of the back, the hip joints, pubic joint as well, sacroiliac at the back, and all of them work really closely together to allow you to do the things that you need to do. The pelvis goes through quite a lot of changes and a lot can be done to the pelvis over your lifetime. You can go through pregnancy, operations, trauma, strained muscles. It takes quite a lot of changes. So making sure that you look after your pelvis and rehab it right will mean that functional strength will come on top of it, basically.
And I assume then obviously it's subject to quite a lot of changes. From things lower down, so from the knee, the foot, the ankle, so if any of those changes, it can have a direct impact higher up.
Definitely. How you load your foot will directly link how you load your knee, your hip, the tilting of your hip as well, and subsequently how you load your back. So we always work as therapists from the floor up, and that's why we do whole body holistic assessments of everyone to make sure that we look at each component and can rehab each as best we can.
Okay, so you talked about a little bit about the stability of the pelvis and keeping it nice and strong. On the hips still need to be really flexible to be able to allow you to do the task like walking, going upstairs. So you've got this kind of mixture of stability and a bit of mobility to try and do it. So what's the role of the muscles then? Why, obviously they've got to stay strong enough to allow you to do the tasks that you want to do. So and that could be getting up off chairs, that could be you taking for a long walk. But then we go to the other end, it's the sporting domain as well. They need to be strong enough to support some of the athletic kind of activities as well.
Yeah, you're absolutely right, Manny. There are so many different components to functional strength. You've got velocity, endurance, power, flexibility, and they are all really, really important around so many different muscle groups of the pelvis. You need to be able to stand on one leg for lots and lots of different kinds of sports, and you have got to have the velocity, change, power to win the race or beat your time. So it's loads of different muscle groups around your pelvis, particularly the glutes, the multifidus around your back, all the core muscles as well, how they work together and how you train in order to achieve your goals.
Fantastic. Okay, thank you. Okay, Rosie, so what is the importance then of maintaining hip strength and pelvic strength as we get older?
So unfortunately, ageing gets all of us. There's no way of escaping it. And physically, ageing can affect us in lots and lots of different ways. Ageing can affect muscle atrophy. So between the age of about 30 and 80, you'll lose up to about 50% of your muscle mass, which is a huge amount, especially if you're not doing anything additional to your everyday job in order to maintain that. So you lose muscle. The collagen fibres in your muscle tendons, so where they're attaching onto the bones, change. The way that they're laid down changes. That can affect your balance, on top of changes in your hearing and
vision and stuff
that's
like
it,
that.
the vestibular system, everything going on there. Your bones change, especially for us ladies. Postmenopausal, it's so important to keep your bone strength up. So using like vitamin D supplements, doing loaded weight-bearing exercises to make sure that it's laid down properly is important. Otherwise, they just get a little bit brittle and aren't as strong. So what happens around your pelvis is all these changes. There's so many hundreds of muscles and ligaments around this big area of your body, if you like. It can lead to you being predisposed to more injuries later down the line. And as therapists, as I'm sure you agree, the majority of what we see in clinical practice is problems with back, lower back, hips, and pelvis areas.
And we see the biggest changes in things like strength around the joints, around the hips, around the lower back, and flexibility. They're like two of the main things that we routinely test, and we find in an older population or an aging population, they seem to go quite quickly, don't they? And they're the ones that kind of predispose people to getting up these little niggles and pains.
Absolutely, absolutely. And thinking about it, flexibility. You don't have to be doing stretches of the same muscle every day.
Yeah.
It's as little as 3 times a week in order to make a difference to
maintain what they've got.
Absolutely.
Okay. So what other things then? Also, we talked about these changes that occur around the hips and pelvis as we get older, and the importance of that. Obviously, then how does it correlate in terms of function? Why? It obviously has a direct correlation with what people can do as they get older, because they're probably in their mindset, the psychology is that you want to do more when you have the time or when you're able to do it, but actually you're then limited by some of the key things that you need to be able to maintain.
It's so true, and so frustrating for people who have done a job or a hobby their whole life, and as they get older and the changes occur that they can't control, and they have done nothing additional in order to maintain that, or they incur an injury, and that feeling of not being able to do the things that you love or have always done has a huge toll. So being able to keep your body, if you like, up to speed with your mental health and mental ability is so important.
Yeah. Okay, thanks, Rose. So we're gonna go through some exercises specifically for the hips and pelvis, but wanted to go back and draw it back to really the why it's really important to maintain the strength around this key area and why it differs from other joints.
It's so important. A lot of the movement patterns that we have as humans come from movement around our pelvis. The everyday tasks like getting in and out of a car, in and out of bed, on off a sofa, onto the sofa, it all comes from loading our lower limbs. What can happen is over time, especially for the walkers among us, we have to walk as part of our daily life anyway. Repetitive loading through your feet, ankles, knees, hips, pelvis can cause a little bit of wear and change in load, and those micro changes in load over time can manifest in difficulties, stiffness, discomfort later on down the line.
And I've seen quite a few people where they've had changes through their foot, and they've had minor operations on there, or they've just started to notice some changes to how they're walking. They may have got some insoles given, or they've changed their footwear, but that's not necessarily where they found the problem first. They started to develop some kind of lower back pains or some hip pains, and they're the signs that actually that area is being worked excessively hard. So sometimes it's the result of all the other things going on.
Absolutely.
Doesn't mean that you don't stop working on that area. It's quite interesting to note that there's so much that impacts, because we've got obviously the pelvis and the spine, and they're so interconnected, and they transfer so much, right?
Absolutely. And what part of our job role as therapists and what we see day to day is your alignment, and what things that we might see that you might not, that you might be carrying yourself for the last 5 years in a way that you weren't even aware of, and how that can have a knock-on effect to other structures above and below the one we're kind of treating.
I suppose we see a lot of, especially you work in the hospitals, you see kind of a lot of post-orthopedic stuff, so hip replacements, knee replacements, and before, in the past, it used to be kind of, you had your hip operation at 70 years old, and we now see kind of people coming through with total hip replacements and partial hip replacements early 40s, if not earlier, and we sometimes just wonder actually how much of the work they should have done beforehand, or what needed to be happening beforehand before they've had that surgery, because actually it's going to be a lifetime of maintaining that strength, keeping that range of movement there.
Absolutely.
And I'm certainly seeing a lot more people through the door that are younger
Yeah, and there's that feeling of, I shouldn't be, I'm not old enough to have a hip replacement. That whole stigma is changing, and that can have quite a profound effect on a lot of people that we see commonly in therapy. You want to know that if you're going forward for a potential surgery, that you have tried everything possible to get it right yourself. And that's why therapy is now being made, almost frontline before the surgery to make sure that you've tried everything.
So it's that preventative as well, isn't it? Really long-time preventative stuff without getting the pain there.
And the metal work that, if you think of the biomechanics and the change in the biomechanics that your body would go through when you have a prosthetic put in, whether it be a half replacement or a full replacement, your body would adapt and change even ever so slightly to that change, and that can have knock-on effects elsewhere.
Yeah, absolutely. I think probably the next thing for us is just go through some exercises, and we'll go and get practical and just try and see what we need to be working on, just so the viewers can just start to get an understanding of what someone could do at home, really.
Yeah, great idea.
Okay.